here to introduce someone I think many of you know, Brad Finegood. He is a great American and one of my favorite people in the world, despite the educational challenge of going to Michigan State University, who UW's going to beat in September, by the way. We love him. He's great. He is a public health strategic advisor for Seattle King County Behavioral Health, and he knows these issues so well. He's got his own personal story. Give it up for my friend Brad Finegood. All right. Go get him, buddy. All right, man.
Thanks, everybody. As Councilmember Dunn said, my name is Brad Finegood. I feel like this is karaoke hour. Deontay, you want to do some karaoke with me? First of all, before I get started, in the back of the room, working the computer is a phenomenal young man named John Candolini. John, will you stand up? And can we all give John a round of applause? John has been every little bit behind every single little iota of today, and it is with eternal gratitude for John. Thank you for all you've done. This is the third year that we've had this conference in conjunction with King County Council, really led by the vision of Councilmember Dunn, and it's just greatly appreciated. I think, you know, for me, it's the coming together, really, that's really important. I'm gonna tell a little story real quick. This is the second time, I don't know, in about 6 months that I've had the opportunity to follow Leo, and this will probably be the last time he ever signs off on going in front of me or having me go after him. So, you know, when I was sitting there thinking about today and what today meant to me, it really reminded me of one of the first times I met Leo, when he had just became the director of the Department of Community and Human Services at King County. And I walk into his office and he goes, "Did you see my new tattoo?" And I was like, I swear to God, I thought he was going to rip open his shirt and it was going to be like this huge Superman tattoo. Because if you know Leo, he is capable of superhuman efforts. And he was like, no, I'm just joking. He's like, it's my one King County tattoo. And I was like, let me see it. And he was just joking. He didn't have it. But then he was like, why don't you get one? I was like, I can get one. But truly today, to me, that this is what it speaks to. And one King County isn't, you know, a cross department effort. It's a community effort. And so for us all to be here in the room, for me, the major takeaway is that we are community and we care, right? And so for us together, I'm just inspired by you all to be here today before you all. Yeah. So, you know, no matter what happens when we leave today, we will have a guiding mission, and that guiding mission is what more can we do? I wasn't part of the honor of sitting in the fireside chat, but I did have the honor of coming after it. And one of the questions that Councilmember Dunn asked is what's the biggest barrier? And there is no doubt that the biggest barrier is stigma, right? And the way that we not only see people who have substance use issues, but the way that people within the system see people with substance use issues. I had a conversation this week with a medical director that I'll remain nameless that asked me what the justification for providing naloxone to people is when it could just enable further use. I mean, I get emails all the time from the community because I'm on the backside of an email address I'll share with you all that was like, you know, y'all can solve your budget problem on Narcan if you just stop handing it out, and then you don't have to worry about keeping people alive. I mean, this is stigma. This is internalized stigma. This is the way that we see people, and this is the way that people see other people with substance use issues. And until we change that as a community, we have a long way to go. The biggest barriers are our own barriers that we create. It's the administrative and infrastructure barriers, right? We heard a story today from Ryan about a recovery house and how somebody got kicked out of the recovery house and died later that night. I heard a story a couple weeks ago from Macklemore, of all people, about somebody getting kicked out of treatment and couldn't get back into treatment until they had been free of treatment or outside of treatment for 30 days. It's a different game than it used to be, right? And I'm going to show you that in a second. I don't know how I got 15 minutes and after lunch, Caleb got an hour. That's ridiculous. Anyway, so it's all good. Anyway, so what I want to take you through real quick is when I was asked to do this, talk about sort of the state of substance use in our county. I really want more than anything to empower you all to know, right? So this website up here is really easy to get to. It's kingcounty.gov/overdose. Right? And it is our front page for everything overdose prevention in the county through the health department. This is a presentation experiment for me because usually it's nice and easy to do this from slides, but I really wanted to walk you through this to see what the resources you have. So if we can scroll down a little bit on there, there's really 4 major quadrants: data, learning, where to get help, how to access different systems of help, ordering material. And then at the bottom is the 3 campaigns that Councilmember Dunn talked about: the Laced and Lethal campaign, the Talk Even If campaign, and the Support Addiction Recovery campaign. Please, on your own time, feel free to do that. We've made sure to translate this into many different languages so that we ensure access, and we'll talk a little bit more about the disproportionalities of overdose in a second. But if we can scroll back up to the top a little bit, at the very top of this page is a couple of different nice little things that, man, I needed to bring binoculars too. So we have a regular quarterly, thank you. Well done, John. We have a quarterly overdose prevention training that you all can feel free to register on, spread the information to other people, and it is really open to everybody. In addition to some other trainings that my friends from the Healthcare for the Homeless Network do, it's just an opportunity to educate and to understand. One of the things we weren't able to get into the conversation today is an overdose prevention training. So those are really what those are. There's also email and text alerts about drug overdoses and clusters that are happening in our community, and information, hopefully, that I'll show you a little bit today. Other types of resources available to you too. But I'd like to, John, if we can click on the view local data icon. So this is all due credit to 2 of my amazing epidemiological colleagues. I didn't even know what epidemiology was until I ran away from having to get tattoos in order to work for DCHS and moved to the health department. So I learned what epidemiology was, and all credit goes to 2 amazing epidemiologists at the health department, Dr. Julia Hood and Hannah Collins, who have worked tirelessly to keep this dashboard updated, many of it with our EMS colleagues, and so much of the credit really goes to the work of the medical examiner's office, who has really been amazingly mission driven about getting information out to the community. This is real-time data. So this is updated today about overdose deaths and what's happening. So in the upper right quadrant is, as Councilmember Dunn spoke to, as of today, how many people have died of overdose this year. And as you will see, and what you don't see is some other preliminary numbers, is as of yesterday, we reached half the number of overdoses that we had last year, many months before the halfway mark. So we're already in a much worse state than we were last year. There were over 1,000 or about 1,000 fatal drug overdoses last year. As Councilmember Dunn talked about half of those involved fentanyl and opioids, fentanyl and some other stimulants, primarily methamphetamine. As you can see down at the bottom right, is that dark blue line is fentanyl, and fentanyl involved overdoses. When I first came to the county in 2014, 2015, we had 3 fentanyl-related overdoses in our county. Last year, we had over 700 fentanyl-related overdoses in our county. Let me just say about fentanyl, when we really started this conference and we started our campaign and our Laced and Lethal campaign, we saw fentanyl starting to come into our community in the form of these counterfeit pills. They looked like an M and a 30. They were primarily light blue. We've seen them in different colors, all that type of stuff. what we're starting to see now is fentanyl come in the form of white powder, right? It's not, people are like, fentanyl's in everything. Fentanyl's really not in everything. Fentanyl just is everything, right? So we're seeing in the form of this white powder where people who are traditional long-term cocaine users who have no tolerance to opioids use it and are dropping dead, right? It's affecting populations and people at an extreme disproportionate rate. John, if we can click on the decedent characteristic tab at the top. I don't think I've ever talked for only 15 minutes. That's what my wife will tell you. So this is the decedent characteristics. So what it looks like for different populations of people. And just know that I'm walking through this really fast because I want it to be a tool for you to know, to use. And if you ever have any questions, you can email me. You can try to call me, but good luck. So we can click on the age adjusted button there. So what this does is it norms it for our population. And one of the things that you'll see that jumps out at you tremendously right away is that American Indian, Alaska Native people in 2022 had about a 9 times higher rate of overdose death than white people. So when we say that overdose death affects people across the spectrum, it really does. But it really impacts certain BIPOC communities of color much more than others. You also see that Black individuals are impacted at about a 3 times higher rate than white people, and Latinx people and people from different races are also impacted at a much higher rate. What this means is that we have not only we have a problem also of who we're communicating with and how we're talking to people. We have to do a better job when we go home today working with people who don't look like me. Because those are also I can share, my comms person's here, so I'm on a tight leash. But I will tell you that when I used to work, when I started working in this field 20 some odd years ago, and I used to work in the correctional system, and I would walk into the prisons and run a group. And I was the only white person in the room. I know this is being recorded, and I'll pay for it, but that's fucked up. And when we see the impact of that on communities of color, when we start to disaggregate the data and look at it more closely, we really start to see the impacts of that. Okay, if you go to trends over time real quick. Man, I keep thinking I'm gonna look up and it's gonna be negative time I have left. So trends over time real quick. If you can just go by, if you can click down on age real quick, under select category. Sorry, John. Honestly, we walked through this and I was like, this is gonna be easy. Anyway, so when you look at the age of folks who are dying, one of the things I want you to know is that this is a problem that we really saw hit hard, especially for youth, and a big jump for youth. And it's really important to think about and talk about youth. And more youth are dying than ever before of overdose. It used to be 5 people a year. And then all of a sudden it jumped to 25 youth a year, every year. But what we're seeing is that older people are dying. Right? You see the 50 to 59-year-old range as the highest impacted drug overdose. If I would have taken a survey beforehand about what population of people are dying most, I would have bet you nobody would have guessed 50 to 59, right? We're seeing a lot of people who are really impacted by fentanyl who have either not been served by other systems well and not been served by our treatment system well. And okay, I think we can back out to the full website, the front page of the website. Awesome, thank you. Last thing I want to show you real quick before I end is that if you go to the order materials and supplies on the bottom right, John, maybe you can click on that. Thank you. Is that we have a ton of posters. We have a ton of material. There's a lot of controversy around drug checking and drug testing and stuff like that. We'll get you fentanyl test strips. right? We're in the business of saving lives. We'll get you naloxone also. And so if you click down at the bottom, you don't have to click down at the bottom, but there's an order form and you can go through and order any of this stuff if you're in King County, since this is supported by King County taxpayer money. If not, call me and we'll figure out like who the best person to get resources is. And so that's our website, that's our resources, that's really what's going on in the community. The last thing I'll say, because this is, I just hit my time, is that I implore you all to take this when you go home today as a charge. And whether you're going home or whether you're watching this, I charge you with two things. Because to me, this is deeply personal. For those of you who know me, you know I lost a brother to overdose. What Ryan said hit super duper home. Why? Not just because of the overdoses that we all have of shared experience, but because of the lack of understanding that we have as a community on best practice and what to do. We have to make recovery more accessible to people no matter where it's at. So we got youth here from the Recovery High School, which is amazing. We got, whether you access recovery, as Councilmember Nelson shared her voice, through going to treatment and detox, whether you access recovery through a peer-led organization, or whether or not you just make connection with people through a harm reduction agency or outreach. We have to make recovery more available for people. And then we have to limit barriers and stop making things so conditional. Ryan was talking about understanding what an overdose looks like and not letting people sleep it off. To me, that's deeply personal. The person who was with my brother the day that he died, when he woke up on New Year's Day, 2004, 2005, he was really hard to wake up, lots of snoring, all these things that are on that poster right there. And she goes, you know what? Sleep it off. You'll be okay. And if we don't educate our community, people use drugs, healthcare system, anybody, about what does an overdose look like and what is best practice. She also didn't have naloxone on her. There was no Good Samaritan law, all these things that we know. But if we don't use what we know and if we don't get out what we know, people are going to die. And people can't access recovery. People can't get into systems of care. People just can't be helped unless that's the case. I leave you all with the charge, two of them. When you go back, no matter where you work, no matter who you are, what policies and programs can you impact to make recovery more accessible to people, to lower barriers, to stop putting conditions on people? And then the last one, to me, and if my wife was here, she'd be really pissed that I say this because I'm already working 15-hour days, but is what more can you do? Because together we can do more. But, as Leo's tattoo said, we can't do it alone. We have to do it together as a county. Thank you.
And Brad was, maybe you know this or not, was recognized by the King County Council with a special award, the first ever King County Recovery Champion Award this year for his work. Yeah, nice.